7 health checkups could actually push you closer to surgery, stroke, or even cancer. Here's what doctors and hospitals never tell seniors over 60. Up to 36% of medical tests in seniors lead to unnecessary treatments, complications, or lifelong side effects. And shockingly, 98% of people over 60 have no idea they're being over-tested. Today, we are pulling back the curtain on the real science. We're going to expose the 7 specific health checkups you should question after age 70 and the truth about what they can do to your body. This is the conversation you may not hear in a busy clinic, but it's one that could protect your health, your quality of life, and give you back control. If you're ready to uncover this truth, hit that yes in the comments below and share your own stories as we reveal each test. Number 7. The brain MRI for mild memory loss. When we become more forgetful, the fear of dementia is natural and powerful. A doctor's first impulse is often to order a brain MRI. But here is the uncomfortable truth. For mild age-related memory loss, an MRI rarely provides helpful answers. Instead, it often reveals age-related changes, things like slight brain shrinkage or white matter spots that are completely normal in older adults. The problem is, once these harmless spots are found, it can trigger a terrifying cascade of fear and further invasive tests. A 2021 study in Neurology Today reviewed over 3,000 MRIs of seniors with mild cognitive complaints. While 86% of the scans showed some abnormality, only a tiny 3% of those findings were linked to an actual treatable condition. This means the vast majority of people were told something is wrong when, for all practical purposes, there wasn't. Worse still, 12% were sent for invasive procedures like spinal taps based on these vague results. Unless there are severe, sudden neurological symptoms like seizures or a rapid personality change, a better first step is a simple cognitive screening test. It's a paper-based exam that is cheap, effective, and avoids the risk of unnecessary panic and procedures. Number 6. The routine bone density DEXA scan. It sounds perfectly harmless, a quick, painless scan to check your bones for fracture risk. But here is what no one tells you. Past the age of 70, a routine bone density scan often creates more harm than good. The scan, officially called a DEXA scan, is used to detect osteoporosis. However, because bone loss is a natural part of aging for everyone, the results in older adults almost always show lower density. This can lead to a diagnosis of mild bone loss, or osteopenia, triggering a prescription for powerful drugs like bisphosphonates. These drugs come with serious side effects, including a rare but horrific condition where the jawbone begins to die, known as osteonecrosis. But does the treatment even work for mild bone loss? A major study in the Journal of the American Geriatric Society followed over 1,200 women over 70 and found that after 5 years, these drugs reduced fracture risk by a minuscule 0.3%. In contrast, a 2022 Osteoporosis International study showed that lifestyle interventions like strength training and proper vitamin D levels can reduce fracture rates by over 20%. Think of Rose, a 76-year-old piano teacher with no falls and no pain. A routine scan showed mild osteopenia, and her doctor immediately put her on a bisphosphonate drug. 3 months later, she was suffering from severe jaw pain and reflux, unable to play the piano she loved. The true, safer solution for her was weight-bearing exercise and a calcium-rich diet, not a drug she never needed. Number 5. The routine PSA, prostate-specific antigen. Screening for older men. The PSA test is touted as the frontline defense against prostate cancer. But for many men, especially those over 70, this routine blood draw, often sets off a chain reaction of fear and harm. Here's the truth. Most prostate cancers in older men are slow-growing, harmless ones that will never cause a single symptom. Yet, an elevated PSA, which can happen for many benign reasons, almost invariably leads to a painful biopsy with risks of infection and bleeding. If cancer is found, even a non-threatening one, it frequently triggers aggressive treatments like surgery or radiation. These cures come with devastating side effects: incontinence, erectile dysfunction, and bowel problems. They demolish quality of life without extending it, all for a cancer that would have remained silent. Consider this. Studies show that for every 100 men over 70 screened, up to 15 will get a false positive, leading to unnecessary biopsies. Worse, for every 1,000 men screened, over 100 will be overdiagnosed, meaning they're treated for a cancer that would never have harmed them. Leading medical bodies, including the U.S. Preventive Services Task Force, are clear. Routine PSA screening after 70 does more harm than good. For countless men, it means undergoing debilitating treatments for a disease that was never a threat. Number 4. The routine cardiac stress test. This is one of the most common tests given to seniors who complain of mild fatigue. The test monitors your heart while you walk on a treadmill to spot blocked arteries. But for people over 70 without clear signs of heart disease, this test often does more harm than good. The reason is its stunning lack of accuracy in this age group. Studies show the false positive rate for stress tests in adults over 70 can be as high as 40%. That means 4 out of 10 times, the test signals a problem that doesn't actually exist, leading to a pipeline of invasive angiograms and unnecessary stent placements. A landmark 2017 study in JAMA Cardiology found that more than half of all stents placed after a stress test referral were done in patients who received no real benefit in survival or quality of life. What they did get were higher rates of bleeding, kidney injury from the contrast dyes, and long hospital stays. If you're over 70 and not experiencing classic cardiac symptoms, like chest pain during activity, a stress test may not be your friend. Safer alternatives like a resting EKG or a coronary calcium scan are often a wiser first choice. Number 3. The routine colonoscopy after 75. This may be surprising as we're all taught the importance of colonoscopies, and they are life-saving when performed at the right age. But for most people, the risk-benefit calculation changes dramatically after age 75. The prep is harsh and can cause dehydration and kidney issues in seniors. The sedation poses added risks to brain function, and the procedure itself can cause bleeding or perforation. A massive 2019 study in JAMA Internal Medicine followed 1.3 million Medicare patients. The findings were jaw-dropping. For patients over 75, for every 1,000 colonoscopies performed, only 2 lives were saved, but over 20 people experienced serious complications. That is a staggering 10-to-1 risk-to-benefit ratio. This is why the U.S. Preventive Services Task Force, the official body for these recommendations, advises stopping routine screening at age 75 for most people. For those in good health, a non-invasive, at-home stool-based test, like a FIT test, is often a much safer option. It requires no prep, no sedation, and still catches most concerning cases. Number 2. The routine annual electrocardiogram, EKG/ECG, for asymptomatic adults. The EKG is a quick heart test. Sounds innocent, right? But for healthy adults with no symptoms, a routine annual EKG is a trap. It routinely uncovers abnormalities that are nothing more than harmless, age-related quirks in your heart's electrical rhythm. The problem? Once these benign findings appear, they trigger a terrifying and costly cascade of further tests, stress tests, echocardiograms, even invasive angiograms. These follow-ups expose you to unnecessary radiation, risky procedures, and immense anxiety, all based on a false alarm. A landmark study from JAMA Internal Medicine revealed that for every 1,000 low-risk adults given a routine EKG, nearly 100 will have a false positive that leads to more testing, yet only one will be found to have a clinically significant new heart condition. This means the vast majority are put through a terrifying and expensive gauntlet for nothing. If you have no chest pain, no shortness of breath, no palpitations, don't invite trouble. Your best heart defense isn't a routine EKG, it's a healthy lifestyle. Number 1. The annual full-body CT scan. And now we've reached the most overused and potentially harmful checkup of all. Full-body CT scans are often marketed in private clinics as a premium way to catch cancer early. Here is the shocking truth. There is zero evidence that these scans save lives in people without symptoms. What they do is expose your body to a massive dose of ionizing radiation. Each full-body scan delivers a dose equal to roughly 500 chest X-rays. This leads us to the most terrifying statistic of all. A 2023 modeling study published in JAMA Internal Medicine projected that the rise in CT scans may now be responsible for up to 5% of all cancers in the United States, putting them on par with alcohol as a cancer-causing factor. This means a scan marketed for prevention could be the very thing that causes the disease. The American College of Radiology is clear. Full-body CT scans should never be used for general screening in people without symptoms due to the significant potential for harm. Using them is like searching for a needle in a haystack with a landmine detector. The search itself could be more damaging than anything you might find. One of my own patients, a 65-year-old woman named Sarah, who shared with me her near-death experience during a so-called routine CT scan. She had previous bad reactions to the contrast dye used in these scans, once fainting, another time being rushed to the ER, and she made sure to tell the technician this. Her exact words to me were, she said, "Oh, that won't happen." They proceeded with the test. Now, I want to read you exactly what Sarah told me happened next. The warmth started, and what came with it was the most traumatic experience of my life. It was like red-hot lava moving up my abdomen to my chest. I yelled, "Help! Help! Something bad is happening to me." That was the last thing she remembered. She had gone into full cardiac arrest on the scanning table. When she woke up, she was in the CCU with 4 fractured ribs from the resuscitation. She had coded for 4 minutes. Sarah's story is a terrifying, real-world example of the cascade of complications that can be triggered by a single test. And it forces us to ask a critical question that many of us are afraid to even think. Are some of the routine checkups we're told are essential for our health actually putting us in more danger than the conditions they're supposed to find? So there you have it. 7 checkups that seem helpful but can actually cause harm, especially after 60. Modern medicine is a powerful tool, but it's not perfect, and sometimes less is more. Before any test, always ask your doctor the most important question. What happens next if this test finds something? If the answer is unclear, or if the risks of the follow-up are higher than the reward, it is your right to pause and reconsider. Remember, real prevention starts with your lifestyle. Stay active, eat well, sleep deeply, and choose your checkups wisely. Your health is too valuable to waste on fear-driven screening that could leave you worse off than where you started.